everyone, and welcome to our program today. I'm Carolyn Colley, and I'm president of the U.S. Chamber of Commerce Foundation. On behalf of our entire team, thank you for welcoming us to your community today. I'd also like to extend a special thank you to our program partner, the AmerisourceBergen Foundation, and our media partner, iHeartMedia, for helping make this event possible. I'd like to take a minute to tell you a little bit about who we are and why we care so much. At the U.S. Chamber of Commerce Foundation, our mission is to educate the public on how business does well, does good, and prepares for the future. Our entire team comes to work every day believing that business is a problem solver. And we're here today to talk about a vexing problem in this country, how businesses can help solve the problem of the opioid epidemic happening in communities across the country. We know that when business thrives, communities thrive, and families thrive, and opportunities grow. And it's harder and harder to do that. It's harder for that to happen when there are barriers to success, when substance abuse destroys families and individuals and communities, and really when it limits hope. 3 years ago, our CEO at the U.S. Chamber of Commerce, Tom Donahue, made it clear that the U.S. Chamber of Commerce and the Foundation would act, that we must act in response to this national crisis. At the Foundation, we began by scanning the national landscape. We wanted to understand what was out there in terms of information and resources and guides that were specific to the unique needs of employers and the workplace and employees and working families. And we learned some important things that helped shape the program you'll see. First of all, it's important to know that most people, in fact, more than 75% of people living with substance abuse disorder are employed. And what that means is that they are our employees, they are our peers and our colleagues, and it makes the workplace an even more important place to help someone and make a difference. We also learned that small and medium-sized businesses are hit just as hard as any other business, large ones too, but of course they aren't armed with the same breadth and depth of resources that they can offer to their employees. So that was a place that we could clearly step in and help. And of course, we all know that these are really difficult conversations to have. While most workplaces we know have a zero tolerance policy for drugs like marijuana and heroin and cocaine, prescription drugs can be a very gray area, and it can be so hard and daunting to even know how to start a conversation with a colleague or a peer you might be worried about. So where can businesses go to help start solving these challenges? That was the question we asked ourselves. And it turns out that there is no lack of resources. In fact, that was the problem. If you pull out your phone or if you go onto your desktop and Google opioid misuse or substance abuse in the workplace, you will get hundreds of thousands of results. But the problem is they're scattered. They appear everywhere. There might be a video here or a PDF there, a one-pager embedded somewhere that's specific to the employer need. And we know it's hard to be a business owner who's got so many other jobs to do inside the company to create jobs and help the community. And people just don't have the time to spend to go and find all those resources and help make sense of them together. So that was another place that we could step in and help. And all of those things helped shape the Sharing Solutions Initiative. We officially launched in January 2019 as a one-stop shop, as a resource hub for employers and for employees. We went out to all of those credible places that you would find on Google and other organizations that come up in search results. And we talked to experts and we aggregated and vetted state-level resources from around the country. And our goal was to make it simple for busy business owners to find the information quickly that they need, that's specific to them as employers, that's specific to them in running workplaces and managing people. We also heard from business owners across the country this question: what does good look like? What can a company like mine do in this regard? I feel very alone. What can I do in terms of looking at role models? I don't want to reinvent the wheel myself. So what we did is we created a catalog of best practices from other businesses, large, medium, and small, to encourage peer-to-peer learning. And we have found that to be one of the most successful parts of this program. Our resource library covers many topics for businesses and employers. Things like, how do I support an employee who might have a problem? How do I support an employee going through treatment? Are there business processes I can change? How can I create continued pathways to employment? How can I leverage the core competencies inside my company or my firm? And of course, how can I engage families and communities in this effort? The second component of sharing solutions is even more interactive, and that's what you're part of today. In 2019, we brought the Sharing Solutions website to the national stage. We went on a tour and stopped in communities around the country that have been hardest hit by this opioid epidemic. And we got together and sat down with small business owners and local chambers of commerce and community service support groups to really have a conversation about what can be effective in the workplace. Well, this year in 2021, our work collides with a new battle, the coronavirus pandemic. And in response, we're hitting the road again, this time virtually, of course, to help arm businesses with new tools to respond to these overlapping crises. It's not one crisis or two, but it's even more. So it's even more important than ever for employers to understand the critical role they play in combating substance abuse in the workplace and by extension in the community. We've got record levels of unemployment and fear and isolation and anxiety that are linked to the pandemic and to job loss. And all of these are contributing to increased substance abuse and deaths related to substance abuse. The combined health and economic crises linked to the coronavirus are creating really unbelievable new challenges for employers and employees. So to talk about this and more, I'm delighted to be joined today not only by national experts, but by leaders from your own community. Thank you so much for joining us today. I hope you'll find collaboration, ideas, support, and a real sense of shared purpose between our community and yours. Please know we're here to help. Please consider the U.S. Chamber of Commerce Foundation a friend and a resource in this effort. It's an honor to be with you today and be part of this together. Thank you.
Hello, everyone, and thank you for joining us today. My name is Katie Pony, and I'm the Vice President of Health Policy at the U.S. Chamber of Commerce. Our first guest today is one of the country's most prominent voices on the national opioid epidemic. Dr. Jerome Adams has served as United States Surgeon General since 2017 and has made substance misuse a top priority throughout his tenure. He's also been a longtime partner of the U.S. Chamber Foundation through work with the National Opioid Action Coalition and the Path Forward series. Dr. Adams, thank you so much for joining us today.
It's my pleasure to be with you. Thank you for having me for a topic that is incredibly important, especially in the midst of a COVID pandemic. Some shocking statistics out there. There was a JAMA article recently that said that in the midst of the pandemic in 2020, we've actually seen opioid overdose deaths by cardiac arrest increase by 100%. In essence, they've doubled. So we have to understand that this epidemic that was around before the pandemic is still there, and it's unfortunately going in the wrong direction.
Thank you so much for that important pressure point in terms of emphasizing the importance of this issue. One of your areas of focus and concern as the U.S. Surgeon General has been on the opioid epidemic, and I understand it's also an issue that hits close to home for your family. Would you please share with us how the crisis has touched you personally?
Well, thank you so much for that question. And I want people to know that, like many Americans, for me, the opioid crisis isn't just pressing, but it's personal. My own baby brother, Philip, served a 10-year prison sentence for crimes committed to support his addiction. He suffered from untreated mental illness and unfortunately turned to drugs to self-medicate. And I share my family's struggle to illustrate that addiction can happen to anyone in any family, even the brother and the family of the United States Surgeon General. And I share my story because I hope to give others the courage to share their stories so that together we can fight stigma. Many of you have heard me say this before, but I truly believe stigma is one of our biggest killers. And unless our loved ones and their families feel comfortable seeking help, we'll never be able to reach those who need it the most.
Thank you. Your openness in discussing your brother's struggles with substance misuse has gone such a long way towards helping to reduce the stigma we often see around addiction. What are some of the ways that we as individuals and members of the business community should be thinking about reducing stigma?
Well, businesses are so incredibly important, particularly in the United States, where quite frankly, many of us define ourselves and our value around our careers, our professions. And I think something that we so easily forget is that the best way for someone who has been in prison and who has suffered from substance use disorder to get on the right track is to get a job. It truly is one of the biggest predictors of whether or not people are going to be successful in treatment and in recovery. Unfortunately, finding stable employment can be a tremendous challenge, as my own brother can attest to. Many businesses refuse to hire individuals who have a record with law enforcement or who have a known history of substance use disorder. Again, there goes that stigma that I talked about. And what do people do when they're depressed and out of work? Well, they often fall back into bad habits, such as drug use and resorting to illicit means of supporting themselves, because in many cases, they don't feel like they have a choice or any other way of supporting themselves. But they also just don't feel like there's any point in trying because no one's going to give me an opportunity anyway. I do want to say there's some good news out there, though. There are companies that are working to reverse this stigma and help rehabilitate individuals back into our communities by removing questions on job applications about previous incidences with law enforcement. It's been found that that doesn't significantly change the risk that they present when they come in, but it does significantly increase their chances of being hired. And in many cases, the data show that formerly incarcerated folks make great, dedicated employees because they are truly grateful for their chance, their second chance to be a part of society. We've seen wonderful examples of companies stepping up to help individuals with substance use disorder get on the road to recovery and return to a job. These employees cost very little to put through treatment programs, relatively speaking, only a bit more than $2,000. And they can save many more thousands of dollars in typical retraining and workforce shortages that businesses are experiencing.
Are there certain approaches that you would recommend as employers look at how to have these conversations? It's been really interesting to hear you talk about the hiring process and how to help when folks are identified as having that crisis. But what should employers be thinking about in terms of how they start the conversation around substance misuse with their employees?
Well, I think that, again, we have to start by acknowledging that it's not us or them. That's how you get stigma. When you separate people out and you say, that's a bad person, that's a good person. I think we have to acknowledge that this has impacted all of our families, and that substance use disorder is not a moral disorder. It is a physical and mental and emotional disorder that has scientific and biological roots, but also that has effective treatments that are available out there. And we need to have the courage to give people a second chance. We need to realize there are win-wins out there for both organizations and individuals, as I've seen in communities across the nation. I think we need to remove the barriers to talking about these things on the job, both the personal barriers and the real legal and workplace barriers that we put up. And we need to talk about what recovery looks like, because I've talked to many individuals who saying that the treatment is the easy part. The recovery, what happens after the treatment, including getting a job and finding housing, is the hard part. But when you provide those supports, again, these individuals become some of the best employees, become some of the best parents, because they're truly grateful. They understand what it means to lose these opportunities And they also appreciate more than many of us, quite frankly, what it means to have these opportunities once again.
Many of our audience members today are small and mid-sized business owners. And smaller companies, I think, tend to have a unique challenge as they try to take steps to combat this misuse in workplaces and communities. Can you speak a little bit to how small businesses can make a difference?
Well, first of all, we need to recognize that overdoses can happen everywhere and anywhere, and naloxone can be a life-saving medication for people who overdose. So every business should have naloxone on site in their office, store, or place of work. Just like you have a first aid kit stocked with bandages and a splint, every business needs to have naloxone. And I would encourage people to go to surgeongeneral.gov to see the call to action that I put out, the advisory on greater naloxone usage by the lay public, encouraging people to think about it like CPR, to understand that everyone can be in a position to save a life. And I just want to share that when you actually look at overdose statistics, we tend to think of a person who overdosed as someone who's homeless, disconnected from society, not someone who's employed. But in most communities, the majority of overdoses are happening to people who are employed. So that means they are misusing, they are at risk on the job, but that job can be a critical touch point where you lower stigma and where you can connect people to care and where you might actually save a life. Another important point is when choosing an insurance plan for your employees, make sure to pick one that offers coverage for mental health and non-opioid pain treatment modalities, because the best way to combat opioid misuse is to prevent it from ever occurring. But if you actually do have opioid misuse or mental health issues, you want people to be able to get the treatment they need and not to feel that they have to hide it from you. W. Edward Demings said, every system is perfectly designed to deliver exactly the results that it's getting. Take a look at your coverage plans. In many cases, we will cover for the doctor to write for all the opioids in the world, but won't cover for the doctor to write for alternatives to opioids. We won't cover for people to get mental health services and to get treatment and recovery services, but then we wonder why we can't keep people employed or why they hide it from us.
Thank you. I'd like to turn back to how you started our conversation today, which is talking about the dramatic increase in overdose during the pandemic. What do you make of this trend, and are there steps that we can take at this moment to address the growing crisis?
Well, truly shocking, truly jarring statistics coming out about the rise in opioid misuse and overdoses during the pandemic, but it really shouldn't surprise us at all, because we know that disconnectedness leads to substance misuse and leads to overdose. And unfortunately, physical distancing, which is good to prevent spread of the virus, is something that contributes to your risk for mental health issues and for substance misuse. Isolation, hopelessness, depression are all major risk factors. And the onset of COVID-19 has created and increased these conditions in a way that most people have never imagined possible. It's become so common to hear people joke about how they couldn't have gotten through quarantine without alcohol. It's no wonder we're seeing rates of substance consumption go through the roof as many people are self-medicating. And I'm very worried by this trend, but I want you to know there's hope at the end of the tunnel. So slowly but surely, life will start to get back to normal. We just got to hang on a little bit longer. And in the interim, we need to all continue to check in on friends and family, support one another during this difficult time, and really think about how we can change some of these fundamentally flawed systems that haven't been supporting the health and well-being physically, mentally, emotionally, and spiritually of our communities, but when addressed properly, actually lead to better health and better economic outcomes.
On that very hopeful note, I'd love to thank you, Dr. Adams, for having you with us. It's been terrific. We here at the Chamber wish you and your family health and strength during this time, and to all of you that have joined us today. Thank you.
Thank you so much. And just want to give a shout out to Belden Industries in Richmond, Indiana, to Greyston Bakeries in New York. There are some great examples out there that if you just simply go online and look them up, are really rethinking how businesses can interact in this space and have actually not only improved the health of the people who work for their companies, but have improved their bottom line. So it truly is a win-win. Hang in there. Follow my 3 W's, wash your hands, wear a mask, and watch your distance. Get your flu shot now and support your employees getting flu shots.
Thank you, Doctor.
Thank you.
Well, hello again, everyone. I'm Carolyn Colley. I'm president of the U.S. Chamber of Commerce Foundation. It's great to conclude with you again with another segment. I hope you found that conversation with Dr. Adams interesting and impactful. He has been such an advocate for this issue and such a good friend to the Chamber and to our Sharing Solutions program. So we really appreciate his time. Now, turning to our next segment, as I mentioned at the beginning of this program, our goal with the Sharing Solutions initiative is to help employers like you understand what you can do in your workplaces, no matter how large or how small, to identify and combat opioid misuse in the workplace. And we know this. We know that we are not the experts, but what we're really good at is getting experts together and people who are leading on these issues and helping answer the questions like, what does good look like? Who's gone before me and who's figured out some hard things? What can I do from an employer perspective? What role models can I follow? So that's what we'll do today. Our hope is that some of these actions, whether large or small, can help businesses like you, also large or small, and that they'll resonate with you. We hope that you'll be inspired by what you'll hear and to help you help your employees and their families and your communities. So today I'm pleased to be joined by 2 CEOs, 2 leaders who are leading in really profound and impactful ways. You're going to hear from them stories and examples of leadership and action that you can replicate in your workplace. Roger Crone is the CEO of Leidos, a Fortune 500 company based in Northern Virginia. And Chad Jester is the president of the Nationwide Foundation, which is based in Ohio. So gentlemen, it's great to be with you today. We've got a lot to learn from you. So let's dive right in. Roger, I'd like to start with you for a second. Now, Leidos is a big company. As I said, a Fortune 500 company. You've got, I think, $11 billion in revenue and 40,000 employees. Tell us, how did someone in your position become involved in this issue and battling this epidemic?
Well, we may be big now, but we weren't always big, and we try to think ourselves as a small company, but we started out as an employee-owned company, and we've had the good fortune of growing over time, but we still have that feeling of smallness and employee ownership. And so our employees feel empowered, and they certainly feel like they can reach out to senior management, that they can reach out to me if they have an issue. And oh gosh, now it's been maybe 3 years ago, I got an email from one of our employees, a fellow named John Heineman, who is one of our businesses in Pittsburgh. And that'll be more important as we speak, because it's close to Ohio and the epicenter for opioids. And John and his wife had lost their son to opioid abuse. And we have a broad portfolio of businesses in Leidos, and about a quarter of our business is in the healthcare area. We do electronic healthcare records, data analytics. We do disability assessments for veterans. And John sent me a note, and he said, and usually the emails I get from employees are, food in the cafeteria or the parking lot, or more mundane things. And his really the URL said sort of a father's story, and he talked about the experience they had with their son, who had been in and out of addiction, had been in recovery, and then succumbed eventually Oxycontin and ended up overdosing and didn't have naloxone or Narcan available. And unfortunately he passed away. And John sort of sent me a call to action and said, we're a healthcare company. What are we doing about this opioid epidemic? And I have been blessed in my family not to, on a firsthand basis, experience the problems with opioids, and so I was frankly pretty unaware. And it led to research on my part and talking to my staff and calling John and actually having a long conversation with John where he recounted the experience he and his wife had had and the toll it took on his family, both mentally and financially. And I went, my gosh, we ought to be doing something about this, and what can we do? And that really was the beginning of the journey, which is now gone on for several years. It's expanded into the broader mental health areas and maybe some other things that we'll talk about here in a minute.
That must have been incredibly moving. I'm really eager to dig more into that as well. Shad, you are the president of the Nationwide Foundation in Ohio. Did this come to you to be a priority? Did you have a moment like Roger did, or was this a buildup in the community that kind of came to your attention? How did you all get started?
Yeah, it's a great question. It's an interesting journey that we're all on when we work on issues like opioids, addiction, mental health issues, and many times there are triggers that get us engaged. So from a personal standpoint, unfortunately, my family has experienced loss through addiction. Losing my brother-in-law to overdose a number of years ago. That stays with you forever. You understand the difficulty of the journey someone with addiction is going through, and you clearly understand the illness that comes with addiction, and that it can be healthy to talk about addiction and mental health related issues. So from a personal standpoint, I've had that orientation for many, many years. At Nationwide, we've done a really good job for a long time of working with our employees through our health and wellness area to support they and their family members who might be suffering from mental health or addiction issues. So we were pretty mature in the space inside Nationwide, again, with our health and wellness team. When the epicenter of the epidemic really hit Ohio, West Virginia, Kentucky, Sam Kionis, an author, wrote the book Dreamland. If you haven't read Dreamland, it's a great storytell on the pathway and journey of the opioid epidemic impacting Ohio and the other two states. And the media was covering the issues so heavily in the Ohio market back in 2016 and 17 that our CEO at the time said, we've got to do something. We have to get engaged in this issue. And again, we had been working internally, which made it easier than for us to face externally in the community and really offer our assistance. Coincidentally, our ADAMH board, Alcohol, Drug, Mental Health Board in the Columbus, Ohio market, was working on an opioid plan. Part of the plan called for a public service announcement campaign. So we talked to the leaders of that organization and volunteered to take on the PSA campaign. I'm not sure at the time we in total knew what we were volunteering to do, but we worked with our national ad firm, Ogilvy, did quantitative research, really wanted to understand the issue best that we could. We talked to families who've been impacted by the opioid crisis, in particular their children who had suffered through addiction. We didn't want to be off-putting with the PSA campaign, but wanted to be motivating to not just inform Ohioans, but prompt Ohioans to take action. That resulted in the Denial Ohio campaign. Don'tLiveInDenial.org is where you can find more information on that. It's research-based, action-oriented. We went at this partnering with our local ADAMH board. We had our community foundation engaged, and soon we found that others wanted to be part of the work. So it started with the PSA campaign, quickly evolved to the Ohio Opioid Education Alliance, and the Alliance now consists of 98 organizations that are public, private, education, and nonprofit entities here in Ohio that are all part of the work. And so we activate the work. We partner with each other. We engage. We share stories. And the more destigmatizing of these issues that we can do through the Alliance, the more benefit we're bringing to Ohioans.
I'm glad that you mentioned stigma. I have not been on this journey for as long as the two of you have, but I've been on a journey of mental illness with friends that I know and professionally, and I know how damaging stigma can be and how limiting it can be. Roger, how much of a role did stigma play in your ability to bring people into the cause and get people in your company and your communities involved?
Yeah, stigma it's a huge barrier because it's a label that nobody wants. Nobody wants to be associated with what is perceived by way too many as a defect instead of a disease. A defect is something that's permanent. A disease is something that really can't be treated and cured. And this really came home to me as I started talking about the problem. The number of people who reached out to me and said, well, Roger, we've had a problem in my family. And in fact, a couple of my direct reports, once we started a campaign, we put it out on our internet site, we started talking about, we wrote articles, I talked about opioid at employee all hands, that people started reaching out and saying, oh, this is much more pervasive than you understand. And one of my best friends I went to college with is a Navy admiral. And he and his wife and my wife, we've been friends now 45 years. And we followed each other's careers. We've met all around the world. And I was at his house for dinner about 2 years ago. And we talked about his two kids. One was at the Navy Academy, very close to where we live, and one was in Colorado. And about 10 days later, I'm doing an opioid event with the paper here in DC at a downtown event, and I get a call from his wife that says, we're going to be at the event. And I said, Mary, why are you going to be at the event? He said, last week we lost our youngest son to opioid abuse. And I went, I've known you for 40 years. You have never mentioned this. And she kind of went through he was in the military, you worry about what that effect is going to be on his career and on and on and on. And it's all about stigma. And they now have a campaign and they've established their own foundation and they're doing great work. But it actually prohibits people from getting treated. And we've done a lot of things in our company we'll elaborate on, I think, as we go on how to break through that stigma and how to create a safe harbor for employees to come forward and actually seek treatment. But stigma is a huge problem.
Well, I'm interested in learning more about what that safe harbor that you've managed to create. Can you tell us a little bit more about that now?
Well, I can. Like all companies, we have employee assistance programs where, and most people, we have a smoking cessation program if you want to quit smoking, and you can sign up for it. And we have a policy that if you voluntarily, check into the employee assistance program, then first of all, the fact that you're in the program will be kept confidential. It's public health information. We don't share it with anyone. It won't affect your status as an employee. We don't think it's reportable. Many of our employees work with the U.S. government, and they may have a security clearance. And so we have to be very kind of careful how we walk that, because if it becomes disclosable, we could put their employability at risk. So we try to create a safe harbor where they can get treatment, they can reach out. We have some benefits that we provide. We have a mental health app that's downloadable on a cell phone where you can get, at least the first level of treatment without even self-identifying yourself. And it's really, really important to give people something to reach out to and a chance to get started on the right path.
Wow, you've taken some remarkable steps to reduce those barriers. What are the misperceptions, Chad, that you have run into in dealing with partner organizations or community groups Are people as kind of enlightened and informed as you and Roger are?
Well, Roger and his team are extremely well informed. So I love the safe harbor. We have a second chance policy at Nationwide. So much the same, right? Enter the program. We want to help you. We want you to stay as a valued Nationwide employee, but there are certain things that you have to do and be accountable to. So I think much the same. And I believe those are best practices in corporate America. It is interesting when we engage with each other, we find where other organizations are on the journey. And I think for Roger's company, for Nationwide, part of our goals are to help share some of these best practices with employers who may not be as far along in the journey, may not have the resources available as smaller organizations. But every for-profit entity and nonprofit government sector, they can look at second chance policies. They can look at using the doTERRA bag as a tool. So we actually passed out these drug disposal bags to our associates and really use that tool to say, use the bag when you have a prescription opioid so you can properly dispose of the medicine. Just saying dispose of the medicine, it can go in one ear and out the other, unfortunately. So we not just try to inform, we try to use tools like the doTERRA bag, and then we did a lot of storytelling. And part of our storytelling were families within Nationwide who were willing to share their story of they were family members who had suffered through addiction to bring it to life. And again, as Roger talked about, it really does harken back to destigmatizing these issues. The more we can talk and be transparent and overt about it, the healthier it will be for everyone. And I think the more apt all of our employees are going to be to engage in the programs that our companies have available. But we did find through our research that many folks in the community, really throughout Ohio, felt like the opioid issue was they were aware of it, knew about the issue, knew it was extremely dangerous, but it was somebody else's problem. And what they didn't know is the data actually said the opposite thing, that no matter what your race, gender, socioeconomic status might be, everyone in the country can really be harmed by the opioid epidemic that we've been experiencing in the United States.
I'm glad that you mentioned disposal and the bag that you held up. Is that an easy thing for employers to buy in bulk and distribute, or how does someone get a hold of?
It is. I'll hold this up again. It's doTERRA is the bag that we use. So our health and wellness team at Nationwide started promoting safe drug disposal. It's not just for opioids; it can be used for any medication. We would go to meetings and set this on the table, and literally participants thought it was a bag of chips. But what you do is open the bag, put the medicine inside, add warm water, seal the bag. The solution inside disposes of the meds, so it breaks down the meds. So it's really effective. What we found in talking about safe disposal is folks in community settings would say, I was safe. I flushed it down the toilet. And all of our public sector colleagues would say, well, you just help pollute the water system, right? So don't flush down the toilet. Don't put in the trash. It can break down and get into the water system as well. So the education curve on all of this is pretty significant. We actually have used the bags with realtors in Ohio. One of our members is Ohio Realtors. There have been folks in our state, and I'm sure others, who will go to open houses with the intent of going through the homeowner's medicine cabinets to steal medicine, right? So in working with the homeowner, the realtor has been able to use the bag to say, properly dispose of what you don't need and secure what you do need. So this ongoing education about proper storage and disposal of medicine is really a key takeaway in this conversation.
Wow, some of those stories sure are alarming. We've talked to employers around the country, and we've heard some really innovative ways that leaders are taking their company's core competencies or their business lines and bringing them to bear. We've, ad agencies or, management consultants, pharmacies changing the way that they manage prescriptions. Roger, when I think of Leidos, I think of data science, engineers, really high tech, a lot of PhDs. But besides helping your employees, help their own families, you brought some of those business competencies to this problem, didn't you?
Yeah, we did. And so we actually analyzed our own healthcare data, and especially our pharmaceutical data. And we looked at the prescriptions that we were reimbursing for opioids specifically. And we found that, like most general practitioners would prescribe a 2-week or a 4-week a dose. And as Chad described, if you only use a week, then you have another week or 2 weeks or 3 weeks of supply in your medicine cabinet. And we thought, okay, I wonder how much of the prescription our employees are actually using. And we did the analysis, and we came to a couple conclusions. One is anyone who gets an opioid prescription through our health and welfare plans gets a Deterra bag about a week after they fill their prescription. So if they have anything left over, they can use the Deterra bag to dispose it. But we also said we're going to stop reimbursing for more than about 2 weeks or 10 days supplies. And the metrics say the percentage of people who become addicted to Oxycontin, Tylenol 3, what have you, after 10 days goes up exponentially. So we're not going to allow someone to fill a prescription for more than 10 days, even though the doctor may have written the script for 30 days, and then they have to go back to their doctor and get a second prescription. Well, what was interesting, so we changed our policy and our reimbursement policy, and then we stood back and we looked at the data. And it's an 80-20 rule. Only 20% of the scripts went back for renewal. Right. So what that said to us is that if we had been reimbursing 2 or 3 weeks, A, we were incurring more expense than we needed to. B, there were unused Oxycontin, Tylenol 3, hydrocodone pills in a medicine cabinet somewhere in our employee base. And so by using analytics and focusing on what does our employee base really need from a treatment standpoint, we were able to solve 2 problems at one time.
Really, really smart. Both of you are so inspiring. I could have 20 more questions for you. We're almost out of time, but I just want to go quickly. I have 2 last questions. One is, the obvious. We are living in a pandemic, and all of the indicators are that, substance abuse, opioid misuse has just skyrocketed. In March alone, overdose deaths were, much more than normal. Overdose calls were, through the roof. How are you adjusting any part of what you're doing to deal with these new pressures and these new stressors on people where they're turning to substance abuse?
Roger, you want to start on that one?
Yeah. For us, what COVID has done is create stress and anxiety for all of us. Where before COVID, they may have been worried about financial security. They may have been worried about their job. Now they're worried about their kids who aren't going to school. They have in-home learning. They may have elderly parents. And so we've really found alignment between the issues around addiction and the broader topic of mental health. And we actually adjusted our benefits. We added financial planning as a free benefit. We extended what we call our temporary daycare benefit, so that if you were faced with a problem where you can't send your kids to school, we actually give them a month of emergency daycare. And so we tried to align and adjust our benefit programs to cover this broader topic and relieve stress from our employees, so they don't feel like they need to seek a morphine-based drug to deal with the now much more intense pressures of everyday life.
Mm-hmm.
Indeed. Chad, are you seeing the same links to mental health in your communities?
Yeah, we are around the country where we have employees. So we've been tracking the numbers for months, which at first were hard to get your arms around. But Roger is again right on point. So the stress causes anxiety. The isolation and working from home for many can cause depression. Alcohol consumption is up. illicit drug use, we believe, is up. In Columbus, Ohio, where I sit, in one weekend this year, unfortunately, we had 32 people die from a fentanyl overdose in 24 hours. So there are stratifications and gradations to all of this. We pay attention many times to the loss of life from overdose, but there are, by multiplying factors, a lot more people fighting addiction and even more at risk of addiction. So as Roger talked about the pill disposal, limiting the number of pills for their employees, we do know through the research that young people can access their parents' pills or grandparents' pills. So there's even more risk just for having the pills in the household. But again, the illicit drugs and the synthetic drugs like fentanyl are really what makes the media. But it is an interwoven story of mental health, addiction, substance misuse, and abuse that we all should be paying attention to.
Indeed. Well, I just want to ask a closing question, which is, we're taking this tour around the country to talk to employers, large and small, urban and rural, who may not have the resources of a large company. What would you say in closing to the owner of a small or medium-sized business who says, hey, I want to take a couple of those actionable steps? What can they do?
Well, I'll start this one, Roger. The doTERRA bags are very affordable. So we've talked to small business owners and said, have a conversation with your employees, make these available. Secondly, as a business owner, recognize that there are issues likely going on in your business. So we've worked with the National Safety Council on a calculator that they have partnered with the University of Chicago on. So it's research-based. You can enter your industry, where you're located, the type of work your people do, and it will give you a calculation state by state on the likely risk factors that you have for employees who might be having an alcohol issue, an illicit drug issue, mental health issues, and it is right on point. We have used that calculator significantly. And then don'tliveinDenial.org, again, is the site that we use for our statewide effort here in Ohio. Great resources there. So bottom line message, there are resources available for everybody. Take a few minutes just to learn and utilize the resources and help save a life.
Yeah, those are great ideas, Chad. I would just add, you're not in it alone. There are many, many large and small community-based organizations, the Community Anti-Drug Coalition of America, DEA 360 has programs in every state. And as a medium or small employer, you are just as affected on a percentage basis as a large company. And as a large company, we view ourselves as just a collection of small companies. And you have health and welfare benefits. You can find a mental health app. You can make that available to your employees. Most of these programs are on a per capita basis. Without a huge discount for volume. So whether it be the doTERRA bag, a Headspace app, changing your employee benefits, reaching out to the community, some of the work partnership with the Chris Atwood Foundation here just in Northern Virginia that provides naloxone to families in the local area. And I think if you reach out and you talk in the local community, you'll find lots of ways to connect and get the leverage that you need to make a difference.
Well, many thanks to you both. I think our audience has learned a lot from both of you, and we really appreciate your leadership and really your personal journey of education and commitment is really inspiring. So thank you both very much.
Thank you.
Carolyn, thank you.
Thank you.
Thank you so much, Carolyn, Roger, and Chad, for giving us that critical perspective. Hello, everyone. My name is DJ Scream from iHeartRadio and 105.3 The Beat. I'm also the co-founder of the Scream Foundation, which is a nonprofit dedicated to educating, empowering, and encouraging our youth. It's great to be with you today and to be a part of Sharing Solutions Georgia. As we've heard throughout today's program, opioid addiction has impacted every community in the state across the country. We here in Georgia are no exception. Addressing a crisis of this scope and magnitude requires everyone who has a stake to be a part of the solution. That includes businesses who are stepping up to help solve the problem. We here in Georgia know we must work together to fight the fight that we must win because we cannot afford to lose. To talk about that and more, I'm pleased to welcome our distinguished panel of guests joining us today. Commissioner of the Georgia Department of Public Health, Dr. Kathleen E. Toomey, Commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities, Commissioner Judy Fitzgerald, Dana Mccrary, the Director of Recovery and Transformation, also at the Georgia Department of Behavioral Health and Developmental Disabilities, and Cassandra Price, Director, Office of Addictive Diseases with the Georgia Department of Behavioral Health and Developmental Disabilities. Thank each of you for joining us today, and let's dive right in. The first question is for Dr. Toomey. You're a medical doctor and commissioner of the Georgia Department of Health. As an epidemiologist who has worked with the CDC, you know how the opioid epidemic has worsened since the start of the COVID-19 pandemic. Help set the stage for our audience. What is the state of opioid misuse disorder in Georgia, and how has the COVID-19 pandemic impacted those struggling with addiction?
I'm so glad you asked that, because this is something we are really concerned about here, not only in my department, but across state government. I think that one of the first things that I learned as I came on board in this position was that opioid use was increasing, and this preceded the pandemic. Then once the pandemic started, we saw increasing use of opioids, and of all sorts. So it's opioids, but fentanyl, heroin, so across the board, increasing use and overdose deaths related to opioids during the pandemic. And this is really interesting. You want to think, why might that be? It's with the lockdowns, with the financial uncertainties, with the fear. And also, if you think about it, because we had to shelter many of the normal supports for individuals who may have been in treatment centers or any other locations where they had to congregate, could no longer go because we were trying to distance. All these things could have an effect and people's ability to cope, and probably led to some of those increases we saw as well.
Thank you for that. Commissioner Fitzgerald, when we talk to any group about opioid addiction, it doesn't matter where we are, warehouse or boardroom, every hand goes up when we ask if they have a personal connection to mental health challenges and substance misuse. You head up the Georgia Department of Behavioral Health and Developmental Disabilities. Tell us about your work and how you're dealing with some of the problems resulting from the opioid crisis.
Yeah, thanks so much. We so appreciate the attention that's being brought to this issue, although you probably experience what we do, which is everywhere you go, people are recognizing mental health and substance use as core issues to people's overall health. So let me tell you about our department and the work that we do. So as you said, DJ, we're the Department of Behavioral Health and Developmental Disabilities, a department of state government. And we are Georgia's public safety net for people with mental illness, substance use disorders, and intellectual and developmental disabilities. So we have a priority in serving those who are uninsured or receiving Medicaid, so a lot of vulnerable populations. But we also contract with over 700 providers around the state to serve people in local communities. One key part of what we do is we oversee an essential component, which is crisis services throughout the state. In every region of the state, we have crisis response for people who are at their worst moment of need in terms of mental health support and substance use disorder. So we are the safety net for those folks. And in terms of opioid response, we play a special role in the state. We are considered the state authority for opioid use, meaning we receive the federal funds, and what we do is put those to work out on the ground, making sure that people have access to what they need. In terms of opioid use disorder, We have 3 areas of work that we do. It's prevention, as you would expect. We're trying to keep people from taking that first, misusing that first opioid through education and through media campaigns. So we've got prevention, we've got treatment. When people when they recognize they have a problem and they need to reach out, can they access the kind of help and support that they need? And then finally, recovery. And this is a really big part of what we do. Treatment is only one part of breaking the cycle of addiction and opioid use disorder. Once someone has successful treatment, what we're working towards is helping people to have a life in the community, and that's what recovery is all about. So we're so proud of the ways in which we put state and federal dollars to work to inform people, to educate, to raise awareness. Lots of folks didn't even understand about how easily opioids can be misused. I want to say one other thing, because none of the work that we do can we do without partners. And an important partner in this effort are not only our providers, but actually law enforcement. And I'm really happy to talk about one important element in the battle is intervention. And we have an important weapon in the lock zone known as Narcan, which is the opioid. A lot of folks are familiar and have heard about this as the opioid overdose reversal medication. So one of the things that our agency does is train law enforcement and other community members about how to recognize an overdose when it's happening, and then actually how to use the naloxone in the moment when a crisis is occurring. And I'm so proud to say that since 2020, we've trained over 1,400 law enforcement members and other members of the community that at that moment of overdose, folks have a tool and they have something that they can use in a critical moment where folks need help. So we're really proud about that, and really happy about the ways we've been able to put dollars to work to open doors to treatment. That's a big part of what we're responsible for.
Amazing, Commissioner Fitzgerald. Thank you for that. Now, the next question is for Dr. Toomey. Dr. Toomey, how do we know we are reaching the people in the communities that are in the greatest need in this crisis?
Well, as Commissioner Fitzgerald said, her agency is the one providing treatment, but our agency has data and information. I'm an epidemiologist. I love data. Data, open the doors and tell me where we need to go. And so in some sense, we are one of her partners because we help to identify those high-risk communities. And we do that through our surveillance programs. It could be the surveillance in emergency departments, which may highlight opioid overdoses coming into the emergency rooms. It could be EMS runs that have opioid-related patients being transported. It could be from our vital records and statistics that identify an opioid-related death or even birth, because we have babies or infants on board with opioid-related syndromes. So there's a large number of our data sets that can be used to help identify some of the highest risk areas, and we can help pinpoint and ensure that we have some sort of treatment and resources there in those high-risk communities. But I also want to say that opioid use is a silent killer, and just because they may not light up on our surveillance system doesn't necessarily mean there aren't opioids being used in those communities. And I think we need to be really sensitive to the fact that resources need to be available throughout all communities.
Thank you for that. The next question is for Cassandra Price. Now, Cassandra, you direct the Office of Addictive Diseases in the Division of Behavioral Health and Developmental Disabilities. What programs are available to family members or their loved ones who are in crisis and seeking recovery?
Well, we've been very fortunate to receive federal dollars from SAMHSA, the Substance Abuse and Mental Health Services Administration, specific to targeting the opioid crisis. And what I really talk about for these programs is around medication-assisted treatment. For those of your listeners or viewers who don't know what that is, it's when we have the use of medication along with behavioral health therapies for an individual who's suffering from opioid use disorder. And I know that sounds very clinical, but it basically is using FDA-approved medications that help normalize brain chemistry, block euphoric effects, relieve physiological cravings, and normalize body function. So it allows a person who's had significant changes in brain chemistry to have a medication that offsets that, along with some behavioral health therapies to improve their situation and be able to work, to be able to be in recovery and be successful. And so in Georgia, we had 2 of these programs that were for uninsured. And with these new dollars, now we have 25. And we have over 2,500 people that have been involved in these programs, which is very incredible. We also have addiction recovery support centers throughout the state, approximately 25. We're growing those all the time. An addiction recovery support center is a place where people who are early in recovery, long in recovery, no matter what time, searching for recovery, can go to get support for their process. And so the people who work and run these programs are certified peer specialists, and they are in long-term recovery themselves. They provide peer support, job coaching, resume building, job search, meetings just to talk about triggers and other issues. And they are really just a life force, just a great support for people early in recovery and even long term. So those are just 2 very specific programs that I think a lot of your listeners would be interested in for people who are dealing with opioid misuse.
Now, Cassandra, let me also ask you, for people who are in need of help, how can they access these programs?
Yeah, absolutely. So I'm going to throw out a couple of numbers, but these will be posted later for people to find these resources. So in Georgia, we have a Georgia Crisis and Access Line. It's an award-winning. Every state wants to duplicate this, and the number is 1-800-715-4225. A person who is in crisis or needs urgent needs or even some resources can reach out 24/7 and speak to a licensed clinician to get their needs met and to get referrals. We also have what's called a CARES Warm Line. That's a certified addiction recovery empowerment specialist. Those are the peers I was speaking of. And that number is 1-844-326-5400. They are 8:30 to 11 p.m. And that's also family members can call and get those resources. I'll also share a list of the programs that I mentioned, and so that can be provided. People can see where they're at in the location and contact information. And you can also go to opioidresponse.info to find out other resources and toolkits out there around prevention resources. So there's a lot out there, and sometimes it can be challenging to find those. So we want to make sure that people know there are numbers to call. There are web pages to visit. There are lists of programs. We want to make sure that the public knows and can access these great resources.
Thank you so much for that information. Now, Dana Mccrary, you are the Director of Recovery and Transformation also at the Georgia Department of Behavioral Health and Developmental Disabilities. And you've seen what addiction can do to a family. Can you share your personal family story with us today?
Yeah, so my father was living with addiction. My mom was living with mental illness, and I myself have been on a journey of recovery from addiction. And I also have a son that is living with both mental health and substance use challenges. And if I could, I just really want to focus on some of the valuable things that I've learned in my own personal journey about mental health and addiction. You know, with both my dad died in his addiction, unfortunately. And my mother had a really challenging time with her mental illness. But what I learned was that I had sick parents. I didn't have bad parents. I didn't have weak parents. I didn't have parents that were making bad choices. I had sick parents. Addiction and mental illness are diseases. They are illnesses. They aren't, people that make bad decisions or choose drugs or mental illness over their children. Nobody wakes up to want to have an addiction or to end up in the hospital. And for myself, I learned that there are many pathways to recovery. There wasn't just one way, there were multiple pathways, and that I wasn't going to be alone, that I could get connected to individuals who had similar experiences. And as a parent of a child who's living with both, I realized that my son needed to journey this for himself, that, I didn't have to feel ashamed about mental illness or addiction. I didn't have to carry any guilt. I don't press those things upon him, and I hold on to hope for him so that he is making this journey on his own. And while he's making this journey, I can contribute and continue to love and support him.
Now, Dana, let me ask you, do you think you're doing a better job because of your personal experience?
Absolutely. Absolutely. For so way too many years, DJ Scream, I walked around carrying guilt and shame from my experiences, from my family's experiences. And I tell people all the time, I tried to outrun it. But what I learned after getting educated was I didn't have to outrun it. I didn't have to be ashamed of my parents. I love my parents. I can talk about the good things that they've done in life, and I can go on and support my children. Education was everything. The experiences that I have helped me to have compassion for other people.
Thank you for that information. So we'll move on to a question for Commissioner Fitzgerald. Now, overdose deaths in the U.S. and in Georgia are higher than they've ever been. What are some of the biggest barriers in serving people seeking treatment for their substance use disorder?
Yeah, thanks for the question. And this is a painful one to talk about, right? Because this is the worst outcome of this disease of addiction that we're talking about. So folks may be familiar with a statistic that has been put forward quite often during the pandemic, and that was that every day 189 Americans die of an opioid overdose. And let me drill that number down to Georgia a little bit. Here in Georgia, what we saw was an increase from 2019, where we saw 853 opioid overdose deaths, to 2020, where that number increased to 1,300 opioid overdose deaths. Now, I'm sharing those numbers with you, but I want you to imagine the human faces and families that are behind those tragic numbers. And I hope that starts to stimulate action and get people thinking about what can we do to prevent this. And I think so one of the most important things is the question you raise, right? Which is to identify what are the barriers, what keep people from getting the kind of help that they need. And I'm going to name a couple today that I think are the most important. And the first one is stigma. And we haven't mentioned that word yet in this session, but I think people are familiar with what this means. And it's what Dana talked about. It's when you don't understand that addiction is an illness, and you're so worried that people will judge you and what they'll think and what it will mean, whether that's your family, your employer, your schoolmates, wherever you are, that belief that I'm a bad person or I'll be judged if I say I need help. That's stigma. That is the first and most important thing we've got to keep addressing. And sessions like this help do this, because opening up the dialogue and getting people to understand it's okay to need help, it's okay to ask for help, and that addiction is a disease. So that's a really, really big part of what we've got to do in this battle, is really break down those elements of stigma. The next thing is really understanding how health insurance works. I mentioned to you that our department really has a priority population for people who are uninsured or receiving Medicaid. But I think individuals who are employed and business owners really need to be thinking about what does their health coverage afford for the people that work for them? What benefit are they offering to their employees? What we know is addiction and mental health issues are prevalent everywhere. Really looking closely at whether or not insurance coverage is going to make it easy for your employees and your own loved ones to access the kind of help that they need. We call this parity in our world. That means parity between a physical health issue and a mental health or substance use issue. And we believe, like so many folks do, that we should have of access. If you have a broken arm or a chronic condition like diabetes, nobody doesn't think you should be able to get into help right away. We think it's the same thing with the disease of addiction. So I would say that health insurance is the second barrier. And then the third barrier we're faced with right now, and of course, businesses all across the country are faced with this. We're in the human service business, and the workforce challenges that we have right now across all human services, but certainly in areas like mental health and substance use disorder present a challenge. So we are thinking about both short-term and long-term strategies to invite people to come into this work. It's so rewarding, but I will say right now it is a barrier that those workforce shortages, we might have a program available, but if we don't have appropriately licensed clinical folks to work in those roles who want to do that, then we really can't provide the level of service that we want to. So I think those are really the top three barriers that collectively we've got to keep working on. And again, I see this conversation as another important way to get at that first one of stigma.
My next question is for Dr. Toomey and Commissioner Fitzgerald. Dr. Toomey, you and Commissioner Fitzgerald are regularly dealing with business leaders across the state of Georgia. What do they tell you about how opioid addiction is impacting the workforce?
You know, it can affect it in so many ways, including absenteeism, requiring that you need someone to fill in because people are in and out because of their drug use, or just employees are unreliable. And I think that's a problem. I had a very funny conversation with a friend of mine who was describing what I thought were his patients, that they're unreliable, there's recidivism, they're just, I can't keep them off drugs. And I said, my goodness, I didn't know that was your patient population. He said, it isn't, it's my staff. And when he said that, I said, oh my goodness, I mean, I had no idea this was something that he was having to deal with within the context of his staff, and yet he didn't have the tools really that the Commissioner Fitzgerald laid out, those kind of resources to offer them, including insurance coverage to be sure that they had the support they needed. So those are some of the things that I've heard.
Okay. Commissioner Fitzgerald.
Yeah, thanks. Dr. Toomey mentioned a number of really critical consequences of addiction in the workplace. She mentioned absenteeism, worker productivity. I think a couple of other things that I've heard in speaking with business leaders. One is really understanding both the employees are an issue, but when an employee has a family member who has an addiction issue, that really is another, and sometimes that's a hidden issue, right? A parent who is trying to manage an addiction issue of a teenager, and the times they have to leave work to address that, and very different from again, as I mentioned, well, my kid was playing sports, they broke their arm, everyone rallies around that person. Well, go ahead, get to the hospital, you better be there. We treat that a little differently than we do when someone says, my teenager has an addiction issue, they've overdosed and I've got to get that to the hospital. Those are the barriers that we really need to break down. We've also heard from employers one other thing, and that is really a workforce shortage because they can't find enough folks who can pass drug tests. So what we know is there's this portion of the workforce that moving from jobs to jobs and not being able to be showing up consistently and reliably. They leave or get fired, set out to go to another job, but employers have said how frustrated they are with the workforce pool that's out there because they find they can't pass a drug test. So I know that's a great source of frustration. I also want to mention here, and we're talking about opioid use disorder. It's such an important thing. I also want to make sure that I mentioned, because we do hear from business leaders and others that alcohol use disorder is also a major problem here. And again, sometimes a hidden problem. It looks like it's under control, but for a person who's battling, their life behind the scenes may be actually completely out of control. And what we know is they're not a healthy or productive worker when that's the case.
Commissioner, employers can play a critical role in the workplace to combat substance use. Tell us about the Drugs Don't Work program you're doing with the Georgia Chambers of Commerce.
Yeah, thanks. I'm glad we have a chance to shout it out because this is an important program that our agency has taken on with some federal support. It's a partnership with the chamber, and yes, called Drugs Don't Work, right? Really a play on getting employers to understand the impact of addiction in the workplace. And essentially, we offer a number of resources to employers. One of the things that we do through this program is that we help employers who decide that they want to become a state certified drug-free workplace. We also offer resources for those workplaces that are interested. We do annual training. We offer sample policies and reduced drug testing opportunities. And one of the other things that we also provide, a little bit as I mentioned, we have resources to point folks to for how to talk to your kids about drugs and drug use. So we've got lots of resources and lots of ways that we can partner with an employer who's saying, I want to make more available to my team members. So it's a great opportunity to connect human services with the employer workforce that's looking for resources.
Thank you for that information. My next question is for Dana Mccrary. Now, finding steady work is part of the recovery process, correct? So what are some of the obstacles we have to remove to help those in recovery find work?
So it would be employers thinking about what policies they can put in place that would allow individuals who may have a criminal background to still apply for the job, that, they've been in recovery, that whatever occurred was years ago, and they've paid their debt to society and giving them the opportunity. So it's creating policies that don't create barriers. And one of them being, if the individual has had a criminal background. The other thing would be, allowing individuals to talk about their recovery out loud. I work for the Department of Behavioral Health. We celebrate recovery. We support individuals who are struggling with addiction. We welcome and support somebody just, wanting to take the first step, and, allowing individuals to talk about their recovery out loud, it not be a secret, is a huge open door in support to individuals. And you never know who else is working for you. It could be a coworker that they could open the door for in support. And so I think the biggest barrier is, overcoming your fears about addiction, getting educated about working with individuals who are living with addiction, and then extending the opportunity to someone. Opportunity was extended to me. When opportunity is extended, magnificent things can happen, because people, addiction doesn't define who somebody is. It is an illness that they have lived with. But these are people that are gifted, talented, artistic, they're leaders, they're managers, they're supervisors, and they have the ability to really make a contribution to a business or organization.
Okay, now, Dana, every day we're hearing about the worker shortage getting worse and affecting businesses across the country. What can you say to employers to encourage them to hire people in recovery? For Dana, people that are in recovery have done a lot of work on themselves. They have done work to make a commitment to their own health and well-being. They've made a commitment to seek other ways, to other doors and pathways to get on the journey to recovery. They've been loyal to themselves, loyal to their recovery.
and they've done a lot of work. Who wouldn't want that type of person working for their organization? Someone who can make a commitment to themselves, to their own personal life, someone that can show up for themselves in their own recovery and can show up for you and your organization. I think, it's wonderful for a business owner to extend the opportunity to another human being to succeed in life. Oftentimes we talk about, if I can just help one person. Well, given an individual who is in recovery that opportunity, you are investing in the lives of more than just one person. You are investing in the lives of their family, their children, their community. So it goes way beyond that person by taking the chance, getting educated, and extending the opportunity. That's the biggest thing, giving somebody the chance to be successful.
Now, Dr. Toomey, let me ask you, in many states, overdose deaths are significantly reduced with broader access to the drug naloxone, or the brand name Narcan. You made this a top priority in the state. Tell us how.
And Commissioner Fitzgerald mentioned this, but this is something that we view as one of our top priorities too in public health. And we have made every effort to get it out into the community, into the hands of anyone in the public or in law enforcement. And one of the things that I was so proud of when I was actually working at the local level in public health in Fulton County is that we worked with all of the law enforcement and were able to not only train them, but make sure that everyone had naloxone and could actually distribute it in the community as necessary to family members and others who may be in a position to be with someone at the time they overdosed. I had a wake-up call in my own clinic, and this is when I was in local public health, when we had an overdose in our own clinic in Fulton County, and we didn't have any naloxone. And I said, that is never going to happen again in our clinic, let alone out in the community. And it really became a real mission for all of us in local public health, and now at the state level, that's part of our ongoing program as well. And so we're trying to make it as easy as possible to purchase naloxone and to distribute it widely in the community, particularly to those who may be first responders like EMS and law enforcement, who may be the first on the scene to be able to help somebody who has ODs in the community.
Dr. Toomey, do you need a prescription to purchase naloxone in the state of Georgia?
I'm smiling because literally the day that I was sworn in, the very next thing I did was signed a standing order. And so that standing order now lets anyone purchase naloxone in any drugstore. And I'm their doctor when they do so. And believe it or not, I have record of all that because of the physician drug monitoring program that we have, which allows us to monitor and track the use of various opioids and controlled substances. I can see when that's used, and you'd be amazed at how often that standing order is used. And so I really feel that it's made a big difference.
Now, before we conclude, it's critical we touch on stigma. We heard Dr. Adams talk a bit about stigma earlier in today's program, and we know that shame and fear can be a tough barrier to seeking treatment. I'd like to ask each of you to briefly tell us how individuals can overcome that fear to help fighting addiction. We'll start with you, Dana.
So a lot of times what contributes to that shame and fear is misinformation, wrong information, incomplete information. And I encourage folks to get educated about addiction, learn what you can. One of the big trainings that we do within the department is language as a tool to combat stigma. And it matters. The words that you use when you're talking to the person that you love, it matters. These individuals may already feel guilty. They may already feel ashamed. And so when we're talking to them, we want to use words that encourage, words that don't stigmatize, words that lift people up and instill hope. So, be careful about the words that you use. Get educated on information. There were so many years that I wasted with having wrong information. I was using wrong words. I thought I could guilt, my family members into recovery or shame them into recovery. And it just made matters worse. So education is key. Using good language is key. Continuously loving the people that are in your family, your coworkers, your friends is key. And yeah, so that's mainly education, love and support, using good language. It's just all helpful.
Cassandra, do you have anything to say about stigma?
Oh, I have a lot to say about stigma, but I'll try to keep it brief with our timeline. I think I definitely echo Dana's comments. I'm a recovery ally. I have family members who are in long-term recovery. I think using our addiction recovery support centers, getting engaged with another peer who's been through what you have been through is super helpful. Another way that we're trying to combat stigma from the department standpoint to help individuals is we had a billboard campaign a while back where we have people who are in recovery on these large billboards, and then you could go on a link and hear their story. So when I first started my career, 20 plus years ago, I never thought I would see the day where we were celebrating recovery on a billboard. So I think those are the kind of messages that we need out there. We're going to do another round of those. And so I look forward to seeing those all over the state and encourage people to look at those stories and find strength in that peer connection, and never give up, and just realize that, recovery should be the expectation, not the exception. So thank you for asking the question.
Okay, and also Commissioner Toomey, do you have anything to say in relation to stigma?
Well, I think we've talked about the fact that insurance coverage isn't always available. I think the more we can reinforce the fact that substance use, mental illness, these are all health problems, and we should be able to get the support we need and the care we need, just like we do for asthma or diabetes. And I think the more we can normalize this as a health issue, and this is something that we can assist you with, and that we can ensure that there's either insurance coverage or support in the community for help, that individuals will feel more comfortable coming forward, and knowing that they don't have to be alone in dealing with their substance use, but that they have help, and the help is there and support is there within the community, with the broader medical community as well.
Now, finally, we've covered a lot of ground today, but really only scratched the surface. We always want to let people know that there is hope. What encouragement can you all offer? What is one message you want to leave with our audience today? We will start with Commissioner Fitzgerald.
Well, thanks. I think Dr. Toomey, the point has really been pressed here. Addiction is a disease. So if people embrace that, but if they know right alongside of that, recovery is real. We've got Dana and tens of thousands of people across the state who are living a life of recovery and productive, happy members of their local communities. It can happen.
Thank you so much for that information. Dana, would you like to chime in?
Yeah, just like, Commissioner Fitzgerald said, we have tens of thousands of peers working in our service system across the state. They are waiting for you. These are individuals who knows what it's like to be in the hospitals, in jails, homeless. They are waiting for you. If you've tried before, consider trying again. We are waiting for you. And because recovery is possible, there are many pathways for family members. Get educated, get ready, have the resources ready for your loved ones. So when they're willing to take the step, when they're ready to take the step.
Thank you so much. Cassandra?
Yeah, we're throwing some numbers out there, and I'll throw one more at you. 24 million people in the United States are living in recovery. 24 million people. So we talk, we have these bad numbers and statistics that we have to talk about, but then there is hope, because there are so many people that are living this life. And so I've always said that if I had to choose the people in my lifeboat, I'd probably choose most of the people in recovery, because I know they could make it happen. I would be very safe with a group of people in a lifeboat who are in recovery, because they are skillful, they are hardworking, and they are they know how to survive. And I think that if you're looking for workers who could pass a drug screen, go to an addiction recovery support center. There's a lot of people there who might be looking for jobs, so there's a resource right there.
Thank you so much, Cassandra. Dr. Toomey, would you like to chime in on the final words?
Geez, the last word, I guess, and it's just that recovery is real and can happen, and we can help access the support you need. And that's something we should all collectively, as a society, here in Georgia, in the United States, be working on diligently to ensure it's available to everyone.
Thank you so much to all our guests, our wonderful panelists today for joining us for Sharing Solutions Georgia. We learned so much about the opioid crisis and how we can help combat it. We must also thank Carolyn Cawley, president of the U.S. Chamber of Commerce Foundation, our staff, partners, and those who contributed to making this program possible. To find out more about resources for all businesses, visit U.S. Chamber of Commerce Foundation website, sharingsolutions.us. I'm DJ Screen from iHeartRadio and 105.3 The Beat. Signing off. Thank you, everyone, for your time.